Hey guys, welcome back to EMTprep's whiteboard. Today we're going to be discussing Pediatric Dextrose. And remember, you can always visit us at www.emtprep.com. And we are also on Facebook and Twitter. So you can follow us there if you'd like. And so just a little disclaimer, as always, follow your local protocols. We're not trying to replace anything. We're just trying to give you an easier way of understanding some of the content within those guidelines that you operate by. So the first thing we've got to ask ourselves is, what is a pediatric? And to be honest, it's kind of a slippery slope. You have hospitals saying one thing, you have departments saying another, parents think it's one thing, you might have grown up thinking it was one thing, you might have heard it in a textbook. So it really varies depending on which source of information you're getting it from. However, for the purposes of this little presentation here, we're going to consider a newborn, anyone under 3 kilos, and we're going to call a child anyone who is between 3 kilos and 37 kilos. So this is also inadvertently saying that if you're over 37 kilos, you're being considered an adult. Whether or not you're over 18 or, that's not what we're talking about here. We're solely talking about drug administration and the amount of kilograms that we're using to determine dosage. So let's talk a little bit about dextrose. We see it come in a variety of concentrations, and in the pre-hospital setting, we're usually going to see D50, D25, D10, and sometimes we'll see D5. It really depends on where you work. Those numbers are really important because they are the concentration of the drug in the solution that they are in. So like a preload or a bag, things like that. And so like I said, they represent a percentage. That percentage reflects the amount of grams of the drug inside 100 milliliters of fluid. So work with me here for a second. Let's take D50 for example, and then we're going to punch it into this equation. I said that that number represents the amount of grams, so that would be 50 grams in 100 milliliters of fluid. So we got to expand that a little bit, and you'll see that we get 50,000 milligrams in 100 mils. So just like back in school, we got to get rid of our zeros, and when we do that, we get 500 milligrams in 1 mil. Now, typically when we're talking about dextrose, we always like to talk about grams of dextrose, not milligrams. So let's convert that one step further, and we'll see that we get 0.5 grams in 1 milliliter. So if you look on your box of D50 next time you're at work, you'll see that the concentration of D50 is 0.5 grams for every milliliter. Now this equation will work for every other number. We can punch it in, and we're going to get the concentration that is also per mil on those preloads that you'll see, or the bag of fluid, things like that. So let's try a practice problem here real quick. Let's say we get called out for an altered mental status patient, and it's a little girl, and we'll say that she's 5 years old. And then we talk to her mom. Mom says she just went to the doctor, and that patient of yours, that little girl, weighs 40 pounds. So the first thing we got to do here is check the CVG. And you work with a great group of guys and gals, and your little glucometer, when you do a heel stick, reads low. So at this point, we've decided, all right, we got to give some D25. Per our protocols, we're going to give pediatric patients D25. So the first thing we got to do now is convert this little girl's weight from pounds to kilograms. And the first step is dividing that 40 by 2. When we do that, we get 20. The next step is subtracting 10% of that number from itself. So when we do that, we get 10% of 20 is 2. We subtract 2 from 20, and we get 18. So this little girl weighs 18 kilograms. So we found out she weighs 18 kilos, and your protocols say that you're to give 0.5 grams per kilogram of D25 for hypoglycemic patients, pediatric patients, that is. So we're going to punch this into our equation here, and we're going to get the amount of grams that an 18 kilogram kid should get. So remember, we've got to do some cross multiplication here. When we do that, we get X number of kilograms is equal to 9 grams, kilograms. We subtract the kilos, and we get grams. So our total dose here is 9 grams of D25.